Hi, my name is Lucina Bennett, and I am asking for the public and society to help me with my cause. I have a debilitating disease called metabolic syndrome. Metabolic syndrome is a combination of factors that multiply a person's risk for heart disease, diabetes, and stroke. Almost 34% of Americans adults are affected. Metabolic syndrome is dangerous because when individual risk factors are seen together in a person, the likelihood increases for cardiovascular problems and diabetes. Many of the risk factors that make up metabolic syndrome have no symptoms until severe damage has been done. So it's important to understand and discuss these factors with your healthcare provider. By working with your healthcare professional, metabolic syndrome is treatable and it can reduce my risk, including the quality and quantity of my lifespan. Just to give a little history of myself, I've already posted online. I've had my gallbladder removed due to multiple gallstones. I've had a total hysterectomy. I've had 3 C-sections. I've had multiple premature births. I have 10 children, and 6 of them were born extremely premature. All of this was due to metabolic syndrome, and I didn't even know I had it until I had to have some genetic testing done. After I moved to Atlanta and after my last child was born in 2007, my weight raised to over 315 pounds. I became real ill. And the solution for me at the time was gastric bypass. I had become diabetic, high blood pressure, my fibromyalgia had flared up, I had joint problems, and I seemed to be losing my eyesight. I had the gastric bypass done October 15th of 2008, and I lost 160 pounds. I kept the weight off. I was cleared for a medically necessary paniculectomy, which took off the large pannus of skin on my stomach, and a medically necessary breast reduction. I thought I was on my way to good health. I took all my supplements and vitamins. I followed my diet closely. And then all of a sudden my hemoglobin level began to drop dangerously low. I ended up becoming severely anemic. I took very strong iron pills and prescription pills and was even going in for iron transfusions until my hemoglobin level dropped into single digits and I almost slept away. After that, I had to be put on double Provera birth control injections, even though I was already sterile from the Esher procedure. Once my hemoglobin levels had increased enough to a safe level to have surgery, I had the total hysterectomy done in 2013. Before the surgery, the first 6 months that I was on the injections, I gained over 60 pounds, and it wasn't from eating. And I will stay on my protein. I use Undri protein, a very good protein of choice. You can use it by going to undri.com. After my hysterectomy, I worked out as much as I could, slowly, because I have fibromyalgia. I stayed on the Undri, and up until this very date, I cannot eat much. But I still drink my protein, and I'm still over 100 pounds overweight. There is a reconstructive surgery available that my insurance will not cover. And I have decided and put it in writing that whatever skin, blood, plasma, and bone marrow, and anything else that is taken from me, I will be donating it to Emory Hospital School of Medicine and to the CDC here in Atlanta, Georgia. I am half African American and half Native American. And because of my ethnicity, there's not a lot of matches for people in help. But I'm willing to pay it forward all I can. I am asking the public to help me, please. I'm very sick. My blood pressure goes up unexpectedly in the 200s over 100s. And I can't take any type of anti-inflammatories because of my blind pouch. So I'm only limited to narcotics. And the narcotics, they don't really help the pain and the inflammation. They just make me very high and loopy, and I can't function like that because I have children. These surgeries that I'm undergoing is not for cosmetic purposes. They are to try to reconstruct my life. My son, Aljamir Bennett, is 18 years old. He's going to college to be a video engineer and into music production. He will be documenting my whole journey through this surgery. I want the whole world to know what it's like to suffer with metabolic syndrome, that you don't have to be shamed. I want people to know that it doesn't come from shoving food in your mouth, and that luckily I'm not developing lymphedema, which is very large folds of skin that carries water and fluid and has to be physically cut off. Please, I need your help. If I was in any other condition and someone asked me to help them, I would do it in a heartbeat. I'm very active with my children. I'm active in my community. I'm on the PTA. I just want to live a normal life. I just want to live to see 50. I just want to live to see 44. I'm 43 years old and my birthday is July 1st. So I'm pleading with the public, if you can give $1, $5, $10, $20, every dollar will help. I'm not asking for this to be vain. I could care less how many scars I have or what I look like after the scars, because they're going to be hidden anyway by clothes. But what I will reveal the scars is to show America and even people internationally, if you hear my plea, that you can get well, you can get quality medical care and help. I'm doing all I can. Please help me. Please donate to my fund and help me to live. And helping me to live, I can pay it forward and help someone else to live. God bless you. And keep praying for me. In Jesus' name. Thank you.